ATLANTIS is a clinical trial platform. It's a multi-centre investigator-led study that's been running in the UK. And it takes patients with advanced urothelial carcinoma who are having palliative first-line chemotherapy. And during that period, we have undertaken biomarker analysis on their archival tumour samples. And then on the basis of those results, patients were able to enter a number of randomized placebo-controlled Phase II trials that were running in parallel as maintenance treatment options following on from chemotherapy. So the data we presented here was for the first of these, which was looking at Rucaparib or placebo as maintenance treatments with a primary endpoint of progression-free survival. So we saw an extension of PFS for patients that received Rucaparib, which was 35 weeks compared to 15 weeks for placebo, with a hazard ratio of 0.53. So this was a small Phase II trial, and we think now that justifies further development of PARP inhibitors, but within a biomarker-selected group of patients. And there was a second trial presented which had similar results in a slightly different clinical setting for urothelial carcinoma. So it's interesting data, we think, and warrants further work.